So welcome to the Aiken Chamber's Ask an Expert. I'm David Jameson, president of the Aiken Chamber of Commerce, and our guest today is Jim O'Loughlin, president and CEO of the Aiken Regional Medical Centers. I think with the way things are changing so rapidly in this country, it's important for me to tell you that this is being recorded on April the 9th, and Jim and I are practicing social distancing. We are 2.6 miles apart. Jim, right this minute, healthcare is on everybody's minds. We see on our television every night pictures of chaotic situations in hospitals. I don't feel like that's the case here at Aiken Regional, and I'd like for you to talk to folks about what's going on at Aiken Regional right now, what's your preparation, what's your bed count, things like that that would help provide us a lot of information.
Well, great. David, thank you. And again, thanks for the opportunity to visit with you, if not in person. But I think it's a great question. I think when we all go home at night and we watch the news or we watch it during the day, if we are at home, we're seeing issues from New York and other scenes. And I would say that those are very serious issues, but that's not a reflection of what's happening in much of the country. So let's talk about Aiken. We've had several weeks to prepare for the coronavirus, and we have been preparing for several weeks now. And so specifically, some of the things that you have seen is a few weeks ago, we restricted visitors, as much as we hate to do that. That was necessary in order to protect our patients, our staff, and our visitors. We have also done a lot of work internally in the hospital, and that is we've created what we call negative pressure rooms, and that's when the airflow is out, and that protects the patients, protects the caregivers. So we have entire floors now that are negative pressure. We have created what we call a COVID unit, where we congregate patients that are diagnosed or suspected of COVID into one location. We've expanded our critical care bed capacity. And one of the issues you see typically on the news is the number of ventilators and how many ventilators are available. We've increased the number of ventilators that we have available for our staff. So presently, we have been doing a lot of work preparing. We've had some positive COVID patients. It has not overrun the system by any means. Now, with that being said, we know when we look at some of the predictive models that the area of South Carolina is expected to see its peak towards the end of this month, but I think we're adequately prepared. And one thing else I'll add, David, if you've come by the hospital at all, is that we have a tent next to our emergency room, and that is a tent that actually we're used for screening, but also has the capacity to handle up to 40 additional patients in this medical tent. So we've expanded capacity appreciably. We prepared our staff. So I think that we're in as good a shape as we could be preparing for what possibly could be an influx of patients over the next several weeks.
It does seem to me that you got in front of this and that you are very prepared. And this is such good information. I think it'll help a lot of people feel more comfortable with what's going on. Let's talk about the healthcare workers. They are like on the ready right now. You haven't been called into service like we hear on the evening news. What's inspiring them? What's inspiring them now? What's their mental health like? How do you feel like your workforce is taking this right this second?
Well, that's a great question, David, and that's something we always watch very carefully. One of the things that, having done this for many years, I'm always impressed by just healthcare workers and their passion for taking care of their fellow human being. Right now, I think our folks are doing well. Clearly what we see across the country is availability of personal protective equipment, or PPE. And we're doing okay. We are concerned that if we have a significant influx of patients, will we have adequate personal protective equipment to protect all our employees? Today, we're doing fine. But I think that's probably the biggest concern is the availability of masks and gowns and exposing our healthcare workers that potentially could then expose their families to the coronavirus. So again, our folks are doing fine. We monitor that very carefully because we know that this is very stressful for everybody because it's different. But right now, I think as long as we have adequate personal protective equipment, people feel like they have the resources they need to be able to do the job that they're trying to do, that we are in pretty good shape.
Jim, you spoke at the chamber, I'd say 8 or 9, 10 months ago to our First Friday group. You talked about that you were predicting major changes in healthcare delivery. Will COVID-19 be the impetus to start that process?
I think some of the changes that we're making out of necessity are going to really accelerate. One of the things we talked about with the chamber was this whole concept of virtual medicine, what you and I are doing right now in terms of communicating via the internet. We are moving very quickly. Most of our practices, if not all of our employed physician practices, now have the capability of being able to see patients virtually. And for some of our patients, and certainly for our physicians, that is something that helps them continue to do what they do without exposing the patients or the caregiver. I think that when this is done, and it will end, is that we will have moved virtual medicine and telemedicine much faster along the continuum that would have occurred otherwise.
Yeah, I think you're correct. And it heightens the emphasis in my mind on the need to solve this rural broadband situation that we have. So in Aiken County, about a third of the people don't even have access to broadband, and that's a problem right now.
Absolutely, and that's a population that is most needy. Those are the folks that have difficulty accessing physicians, and being able to access a physician or the healthcare system through a virtual network would be it's such an impact on that population.
So what can the business community do to help Aiken Regional right now?
You know, David, the business community has been just outstanding. We have received numerous donations in terms of masks and products, restaurants reaching out. I have just been so impressed with the business community rallying around healthcare workers in this facility. What they can continue to do is we have had several businesses that have had access because of what they do to personal protective equipment, like construction companies. We've also have had dentists and others that use masks that are not currently using those because of the restrictions we have. And we've had donations to this facility for personal protective equipment. We've had a number of restaurants that have wanted to feed our employees, and that is so much appreciated. So we've had an outpouring of support from the business community that it really has been heartwarming and just shows why we are so appreciative to be in Aiken and be part of this community.
I think you're hitting on, we say a lot of times, if you're lucky enough to live in Aiken, you're lucky enough. And Aiken always has this spirit of helping and caring. It's something that Aiken is known for. So thank you for taking time out of your schedule today to be with us. You provided us a lot of great information. Stay safe and be positive.
You too, David. And again, thank you for the opportunity to give the business community an update.